Aside from any issues of safety or effectiveness, what of the ethics of mandatory water fluoridation?
The treatment of people through the water supply, which is this mandatory water fluoridation, which is almost a treatment that most patients have had enormous difficulty avoiding. Well, there's no ethical basis for it, because in herbal medicine, in normal medical treatments, chiropractic treatments, osteopathic treatments, dental treatments, the patient always has the ability to submit or say no to the treatment. And that is where the compulsory treatment through the kitchen tap with an active chemical agent is absolutely running right across those normal medical ethics where somebody has the ability to refuse treatment.
Is the public water supply an ethical or valid mechanism for the delivery of a drug or any drug?
Not at all. In terms of treatment, any therapy must be given according to the patient's requirements. So treating through the tap water is an absolute crazy administration of a therapy. As a naturopath, I might think, yes, wouldn't it be good if the herb echinacea could be added to the drinking water? And when they were fluoridating Melbourne, I was undergoing training in herbal medicine, and I thought, oh, they're putting fluoride in the water. I thought it was good at the time. I thought, wouldn't echinacea be wonderful to boost everybody's immune system at the same time? But it was only when my first patient got abdominal pains from echinacea, I suddenly realised, I really messed up my therapeutic clarity of mind by thinking such a thing, because some people cannot tolerate medicines regardless. So it's totally inappropriate to administer a medicine in drinking water.
How can you control the dosage? That is, how much people actually drink.
You can't, and you can't modify how much of the medication people are taking by administering it to the drinking water. Simple as that. And enormous varieties of reactions occur when people are training for athletics. They'll go through 4 or 5 litres in a training run. They've exceeded the recommended dose 5 times, and lo and behold, they start to show the cramps in the muscles when they're training, and you tell them to get onto the pure water, and guess what? The cramps in the muscles disappear. So totally inappropriate to apply it to everybody in the expectation of that mythical safe dose is going to be given to everybody.
Great, and you've almost answered the next question, but I'll couch it anyway. Do some groups, such as diabetes patients or athletes, drink more water than others?
Yeah, some people have an enormous intake of water due to medical conditions, diabetes insipidus, where you just get the kind of intake of water elevated. Athletes who are dehydrating, you get a huge intake of or variation in intake of water, so you get the intake of the medicine varied, and no doctor would ever prescribe a sedative on the same basis of your dose would go up 3 or 4 times if you went training for athletics. Crazy.
As a professional, or from a personal point of view, what would you like to say to other professionals about where Australia should be heading with fluoridated water?
In terms of where we should be heading with fluoridation, critically there is a need for researching the safety of the treatment. First and foremost, even more than the effectiveness of it. Because at the moment, from the clinical studies that I'm seeing with patients, they appear to be getting affected by the fluoridated water, and often badly, to the point of of being, whether fluoridated water is indeed a risk to their life. And that is not only recognised by myself, and the patients and their families, but also by their dentists and doctors are also very aware that this is the case. So it is critical that the government starts working towards resolving this question about its safety, because no doctor should ever be giving a treatment totally unaware of the safety aspects of it. And secondly, the safety aspects are not being pursued, not being looked at. And that is completely unprofessional for any practitioner to pursue such a line of irresponsibility with their own treatment of patients, and for the government to be giving a treatment where they appear also to be not pursuing the aspects of, is our treatment of the community by fluoridating their water safe, is quite irresponsible. And as I say, when I've pursued that with health authorities and said, could they do studies into the safety with patients who appear to be getting sick, then so far there's been a complete refusal to do any such assessment. And I've never seen that with doctors viewing side effects of their own drug treatment of patients, or myself with treatment where people are getting reactions to herbs. You always follow it up to assess the safety or otherwise of it. And if it's shown to be unsafe, change the treatment. Now, that's where the government is absolutely refusing to follow that line. And that's what I say to other practitioners, that they should be looking at that in terms of comparing the government's sort of ethical standards with treatment of the community through the water with their own standards of treatment of their patients, and there should be a continuum between the two. And that's basically one of the reasons that I started doing the research to collect the data on people becoming or reporting illness from the fluoridated water. It was to act as a confirmation that yes, people are getting those side effects, and as the research program grows, we're getting more and more input from interstate in Australia and overseas, with people contributing the data, and it's certainly showing, as the numbers of affected people who are reporting symptoms increase, it's looking more and more urgent that the government start to do a proper assessment of the ethics about what they're doing by establishing a system of testing people for the safety of fluoride. Because if they don't do that, the clinical practitioners will have to organise proper pathological testing in an absence of government responsibility being shown.
Well, it seems from what I've heard through the interviews this morning, if fluorosilicates have been banned in Europe as known neurotoxins, why on earth are we still, in this day and age, putting fluoride in the 3 compounds of fluoride are used in Australia? Why on earth are we doing that here if there's so much evidence now that actually says it should be banned as a neurotoxin? Why on earth would Australia go against the best scientific knowledge and most of Europe? Why on earth would we want to stick out as the ones that are in the dark ages? Especially if we're not prepared to do testing.
Well, that's where it gets to the question of just what on earth is going on. The safety aspects are not being pursued, not being looked at, and that is completely unprofessional for any practitioner to pursue such a line of irresponsibility with their own treatment of patients, and for the government to be giving a treatment where they appear also to be not pursuing the aspects of, is our treatment of the community by fluoridating their water safe, is quite irresponsible.